I really didn't know anybody with Down syndrome while I was growing up. It wasn't until I was a senior in college. One of my clinicals was at a day services program for adults with mental disabilities, and I met a guy named Larry there, and probably Larry was in his early 20s, and he had Down syndrome. And I really liked him. And he couldn't talk very well, but you knew what he meant. So he'd say, hi-ha, hi-ha, ha. And that meant, I've got hair, you've got hair, we both got hair, cool. I got a job at Children's Mercy here in Kansas City, and I started working with little people with Down syndrome. I worked in the ICU, and we repaired a lot of hearts because about a third of them were born with a particular heart defect. And so we fixed a lot of those little hearts, and I loved those little guys and their parents, and I loved taking care of them. So whenever a kid with Down syndrome came through, they always made sure that I took care of him, and so I really liked that. Then I went to get my master's at Iowa City and thought I wanted to stay with the Downs kids. I really enjoy them. And so I took several genetics classes, and again met several kids with Down syndrome. And I did my thesis with a little girl that was 8, and she had Down syndrome. And I just continued to enjoy it. I went to my first national Down syndrome meeting. It was in St. Louis, and I went to that and just really enjoyed those parents and those kids. And while we lived here in Kansas City, I met a friend of mine named Priscilla Sue. And Priscilla Sue went to my church, and she had Down syndrome. And I think when I met her, she was 13 or 14, and I've stayed friends with her. She's 50 now, and I've stayed friends with her all these years. And she's always come to my house wherever we've lived and stayed with me. And she's just, my kids grew up with her, and they have always been around here. I've taught Sunday school classes for kids with disabilities and for adults with disabilities, and it's just always been part of our life. I ended up doing my dissertation on adults with Down syndrome, and what I found out was that they can stay in the public school system until they're 21. And a lot of them graduate at 18, but there's an extension program they have till they're 21. So really at about 20 or 21, these parents and kids are just dumped, and they don't know where to go and who else to talk to. After I completed my dissertation, it took me a couple years to get my feet back on the ground, and then I decided to start a clinic within the confines of family medicine that was just for adults with Down syndrome. Anyway, there's just a need there because there's just nobody that knows what the unique health care issues are for the adults. I can relieve one burden for them, and they don't have to worry about, are they going to get called back? Or are they going to get the attention that they need, or what are they going to do? Your tendency is to overlook them and go to whoever the care provider is, and a lot of healthcare providers look right past them, and ask their parents or ask their care provider, well, what do you think? Does he do this? And how? Instead of talking to them, and that's real easy to do, and it's hard sometimes to wait until they come up with the answer, because up to this point we've always said, they've got Down syndrome, and oh, by the way, they have Alzheimer's or they have dementia, and so we take care of them in one particular way. And I'm thinking maybe what we ought to say is they have Alzheimer's, and oh, by the way, they have Down syndrome, and maybe we change how we cared for them a little bit, because we put in the Alzheimer's protections first. It used to be when you were told you had a kid with Down syndrome, you knew you'd have to take care of them the rest of their lives, and they'd live with you for the rest of their lives, and that isn't the way it is anymore. And so we have to help the parents get ready to let go. So I think they're going to demand some of the things that we kind of take for granted, and society's going to have to respond to them. And so they're not going to live with their parents until they're 40 or 50. The kids in 20 years are going to be much smarter, much more independent. I would like to work with housing. We have a lot of kids that might in the future be able to live, with some assistance, but mostly independent. And then if I had enough money, I would start a job center. These guys are very good workers. If you find something that they can do. They're very good workers. They don't call in sick. They're there every day. They're there on time. They stay till their time's over. They're very good. And everybody knows what a person with Down syndrome looks like. You know, most everybody can identify them. You know, but and when you get to know them, they're great people. They're just great people. They're friendly and they laugh and they love you. You don't have to do anything. They love you. It doesn't matter. You're the best ever. So that's nice in this world where we're pretty critical. It's nice to have somebody that loves us regardless.